patient management system is very inefficient and disorganized at least. And this does not only is not only bad in technical terms, negative in technical terms for Kosovo, but it's also negative, it affects negatively the treatment of the patients. The research that was conducted during this capstone project suggested that a computerized version of the patient management system could help to reduce the negative effects of such disorganized patient management system in terms of helping this patient management system become more organized and more efficient. That is why, through this research project, I looked into functionalities and specifications that would make this patient management system in its own more organized, and also at the same time evaluated Kosovo's current health information strategy, which is available in terms of the findings of this project. The research suggested that throughout the world there has been an increased usage of computer technology in medicine. This computer technology has helped to advance medicine not only in technical terms such as fewer waiting lines or increased interactivity between users, meaning patients and doctors, but also it has caused substantial advancement to the diagnosis and treatment process itself. With these patient information systems and health information systems in general, which have incorporated computers into medicine, less mistakes have been done in diagnosis and in treatment as well, in treatment of the patients. In the national level, these patient information systems have helped government ministries to allocate the resources better, meaning to award hospitals that are doing better and to punish those that are not. And at the same time, it has helped governments to trace epidemics and to stop them in time. During the process of implementation of these patient information systems, of course, there have been some challenges which countries and hospitals have faced. One of them is the slow input of existing data, which might be a problem for Kosovo as well. Since we have a lot of current data on patients that are not yet computerized, when we implement the patient information system, we will need to do that. And this process takes quite a lot of time. In addition, even a bigger challenge that patient information systems have brought before people today is the fact that they have been not as much as user-friendly to technology illiterate groups, in which unfortunately the elderly make up the most of these groups. This also might become a problem for Kosovo. However, most of the countries that have started implementing patient information systems are fairly satisfied by them, and they suggest that they say that the benefits that they have been deriving from patient information system far outweigh these challenges, if I might refer to them as such. In Kosovo specifically, there have been some issues with the medical system in the past. There are few doctors to cover the whole population. The standard in EU is 4 doctors per 1,000 people in an area, whereas we have 1 doctor per 1,000 people. In addition, there has been no coordination between departments in the same hospital or between departments and hospitals that are distributed across Kosovo. This has contributed to erroneous treatments and diagnosis, and it's contributed to technical issues regarding to distribution of the files of the patients. In addition, in a national level, this has contributed to inefficient use of resources. Furthermore, the Ministry of Health has often been criticized for not using its resources in the best way possible. It has been criticized for purchasing medicines and devices with prices that have not been appropriate for those devices and medicines. Currently, Kosovo does have a health information strategy, and the Luxembourg Development Agency has signed a contract to fund such health information strategy development. In order to pinpoint the functionalities behind the health information system that is to be applied, patient information system that is to be applied in Kosovo, for this research, surveys were conducted with the stakeholders, namely with doctors, nurses, and patients. Doctors and nurses were surveyed through the help of contact persons in each of the 7 major hospitals throughout the 7 cities in Kosovo. They were distributed based on strata, meaning for each of the strata, such as nationality or department, there were a certain number of doctors that had to be surveyed and nurses. Patients were also surveyed through contact persons in different hospitals, also online, and they were also stratified based on nationality. In addition, an interview was done with a representative from the Ministry of Health to understand the perspective of the ministry as well, to understand the functionalities needed by the ministry to incorporate in this patient information system. The patient information system in other countries, such as Macedonia, Serbia, Norway, and Palestine, were also evaluated in terms of seeing how can Kosovo's PIS future look like, and in what direction should Kosovo as a country work in order to improve its PIS. Furthermore, the Kosovo's current health information strategy was evaluated, and its final recommendations were compared to the findings of this project, and additions and changes were recommended to this health information strategy to reflect the perspectives and the needs of the stakeholders better. The surveys of medical staff, for these surveys, 190 doctors and nurses were surveyed, and these findings suggested that generally there is a tendency to rate all functions as important. The rating of the functions was from 1, which was the least important, to 5, the most important. Most of the functionalities got very high ratings. However, there are 5 of them that have ratings of 4 or more, and these are diseases, treatments, analysis, and administrative functions. The rest of them, including visual information, patient allergies, living conditions, and personal information, have received lower ratings compared to these 5. Nonetheless, because these findings lacked variety, this research project looked further into prioritizing the top functionalities to make a difference between what's really important and what's not that important and can wait for longer. That is why these same doctors and nurses were asked to prioritize only 3 functionalities, and these were the results from this question. So diseases, treatments, and analysis results were rated, and administrative functions were rated really high by and were considered as important by many of the respondents. For example, diseases was rated in the top 3 functionalities by more than 80% of the respondents. Patients were also surveyed in order to understand their perspective better. 230 patients from cities across Kosovo were surveyed, and they were asked to prioritize their top 3 functionalities that they would like to see in Kosovo's future PIS. And what the results suggest is that they would prefer to have scheduling session functionalities, contacting the doctor functionalities, and downloading the medical history functionalities in Kosovo's future PIS. Ministry of Health perspective was also considered in this research project. What can mostly be said about the Ministry of Health to summarize their needs from in this patient information system is to have statistical tools. They need this patient information system to provide them with statistics about hospitals, about doctors and nurses, and about treatments in order to know their success rates, in order to be able to award those that are working, to punish those that are not working, and to see the problems with different treatments that are currently being used in Kosovo. This tool can also be used to stop or to prevent epidemics in case those come here. And this, what we will also do is help the ministry to increase the efficiency of the usage of the resources. Because through this tool, the ministry will be able to have the information in real time and to act upon it. So this statistical tool will be used in the policy making process of the Ministry of Health in Kosovo. In Kosovo's health information strategy, there have been predicted some of the functionalities that Kosovo's health information system will have in the future. And they are broken down in these 4 main categories, which are patient care, registers, security, and enterprise resource planning. There are also other functionalities that have been predicted by the health information strategy of Kosovo, but which are not relevant to this research project. Kosovo's health information strategy, the Ministry of Health has taken care of doctors and nurses' needs very well with the patient care category of functionalities, in which it has foreseen how patients will come into the hospital and how doctors will be able to take care of them and to know where are the patients at each step of their treatment, and how they can also schedule meetings and appointments, not with themselves, but also with other specialists that they see fit that the patient needs to contact with. In addition, they have predicted to have these registers of patients and the statistical tools which will help them, and have predicted to have the billing support, which is a very important functionality and a bit controversial, on which I'm going to talk a bit later. Through this billing support, they will regulate the financial side of payments to the hospitals. When this research project looked at the PIS in other countries, it had these four main conclusions. So in Macedonia, the approach that Macedonia took when it developed its PIS was a department-based approach. Basically, it started by implementing the patient information system in only one department, and then gradually it added other departments in the whole patient information system. So it integrated each of the departments individually. Whereas in Serbia, Serbia chose a more treatment-based approach, which meant that for each type of treatment offered in their hospitals, they created a specific functionality, which was then attributed to all of the departments. So they were not interested in having specific departments, the computer technology incorporated into specific departments, but rather throughout treatments. Norway has one of the most advanced PISs in the world currently. From a simple technical tool, now Norway's PIS is a platform for advanced scientific research. This large pool of data has helped scientific research in terms of treatments, in terms of medicine, and it has helped basically Norway to overcome a lot of problems, diseases, and issues because of the large pool of data available to these scientific researchers. In addition, Norway has created this opportunity for students and for universities to also have access to data in patient information system. Of course, it has had huge consideration and debate over the privacy issues, and it has come to a conclusion to permit them to access data only in numbers, not to know, for example, the specific information about patients that have gotten a treatment, rather than just their medical history and their ID number. Palestine was, patient information system was looked upon because it used DataStar, which is a commercial package which Kosovo intends to use through its health information strategy. The reviews were pretty good. It seemed that health institutions in Palestine really liked the outcome from DataStar. However, it was maybe probably due to the condition their information was really not revealed from the ministry, but rather from outside sources. The price was not mentioned, not even once, in all of the documents that were researched during this research project. However, one key characteristic that the DataStar was made sure to mention for the Palestine case was the fact that it focused a lot on backup and restore functionalities, meaning that all of the information stored in this patient information system were really secure and protected. And this might have caused the price to be high. The price, although not from official information, may have reached up to $30 million. So the results, meaning the interviews, the surveys, and the PISs in other countries, in overall suggested that in Kosovo, all of the stakeholders, including patients, doctors, and nurses, prefer simple rather than advanced functionalities. What this does mean for the current condition of Kosovo is that we will have a more basic patient information system rather than a more complex one. Both Serbian and Macedonian approaches were preferred by the stakeholders. From the answers of the doctors and nurses and patients, we saw that they prefer more the certain approach, so functionalities that go beyond departments but rather are focused on treatments. However, from the perspective of the ministry, the mass billing approach is very important because ministry needs information in each of the departments. In regards to data cell, unfortunately, this it cannot be said that much since the lack of data. In regards to health information strategy, although the needs of the doctors, nurses, and the ministry were well addressed, there was a significant lack of patient-related functionalities. Having this in mind, this research project recommended three main recommendations. In regards to technical composure of the PIS, this research project recommends, if I may go to the next slide, this is how the main functionalities of this Kosovo's future PIS will look like. At the center, we will have administrative functions, which will deal with all of the main issues such as registering patients, adding information, and it will be in the center of all of the rest of the functionalities. The needs of all three stakeholders have been addressed through these functionalities. We will have for the patients, through the administrative functions, they can schedule the meetings with their doctors, and they can also contact with their doctor through administrative functions. They will be able to download their medical record, and this is important because this research project has foreseen to implement this patient information system only in hospitals, but if need be that patients might go to other health institutions in Kosovo, then they can have their medical record as a temporary measure before this patient information system is further distributed to all health institutions in Kosovo. In addition, hospitals will have access to the medical record of the patients to include diseases and treatment, and they will also have access to analysis results, and which includes both the type of the analysis and the results that those analyses have come with. The ministry's needs will also be addressed with the statistical tools that will be incorporated in this patient information system, and this statistical tool will give information to the ministry about the medical staff, about the departments, and about the hospitals as well. In addition, this research project recommended to combine the approaches of Serbia and Macedonia when joining the PIS, and also to start planning from now about reaching Norway's stage, which is really important strategical point for Kosovo. We are now in a phase, in an advantageous position, I would say, since all of the countries have started to implement this patient information system and have started to make them very powerful scientific tools. And basically, we don't need to reinvent the wheel. We have the information that these countries have had, and we might readily use it to turn this patient information system into a very important scientific tool. Kosovo's health information strategy needs to be revised, especially in terms of adding more patient-related functionalities, and these might be downloading the medical record and also adding the possibility of contacting the doctor, or patients having the possibility to schedule meetings with and appointments with their doctors. I talked earlier about the billing and transaction functionality. In the results I got, patients were not ready to use this functionality, so I would suggest that for now it would be ill-advised to have this functionality ready for patients in their patient information systems, since even if this functionality is ready available for patients, it is not clear of how much they would use it or whether they would use it at all. So further research is needed in this area, in addressing the issue of billing and transaction functionality better, to look at why are patients so reluctant to use it, and what might the ministry do in order to promote the usage of this functionality. Future research in this regard needs to be done in also incorporating other health institutions into the patient information system, which is now predicted only for the 7 major hospitals. and also incorporate this whole PIS in a larger health information system, which would deal also with pharmaceuticals and with private clinics, which would include a whole larger and broader scope. So this is all for today. Thank you very much for your attention.
Questions? My big question really is really still, you look at these information systems from an institution or a hospital point of view. What happens when you start thinking about a nationwide point of view? In that I could see in a state like in Kosovo, where it's a national health scheme, more and more private organisations, yes, but what happens when you start thinking of data exchanges where you have a mixture of private and state-owned hospitals? Are you still thinking of how do you transfer data from hospital A to hospital B, even when they have different computer systems?
For now, we're in a good position since none of the private clinics have such a big information system. But what I would suggest is to create some basic protocol that would allow different hospitals data to communicate with each other's servers without having any interruption in the flow of the data. This is also done in other countries. In Austria, their patient information systems vary from each other. However, they all meet at one point, which is at the Ministry of Public Administration, I believe. We could do the same here. All the data could be brought to Kosovo's Ministry of Public Administration, and then from then further processed on. And this would be the point where they are all standardized, even if all clinics do not use the same patient information system. Again, as strange as this might sound, we are in an advantageous position because we could use the knowledge that is readily available and the practices of other countries which have been proven upon and tested upon, and then we can get to choose the best way to further go on. So I guess there is a bright side.
You mentioned a few times the situation in Norway. Is that a mixture of public health plus private health? Do you know what percentage people go to a public hospital as opposed to a private?
I did not look at that information, but they use a similar system to Austria when it comes to standardizing the data. Nonetheless, despite their specific methods, it has been proven to be one of the maybe the best patient information system in the world currently. And this is largely has to do with the fact of how they use the data and how they've incorporated other stakeholders besides the three we mentioned in this research project into their information systems.
I'm curious. I mean, when you compare it with Germany or France or other European countries, how Norway, what criteria has been used. Okay, so just my final comment would be or question is about the sort of investment. So when you start looking at Kosovo, what sort of financial investment in the computer sector is going to be needed?
Has been done so far?
Well, I'm thinking more of the future. What else needs? How much money is needed? Do you think?
Well, basically,
Tens of millions, hundreds of millions.
tens of millions, I would say. In the research project I wrote, I did not have the necessary information, unfortunately, but I predicted around $28 million. This whole project would cost around $28 million. And what has been done so far is that the hardware has been laid out in all of the public hospitals in Kosovo. The software is yet to be implemented, and that would cost $28 million without the hardware, just the software.
Any final question?